feel strongly that the remaining therapeutic use of these antibiotics for disease prevention, control, and treatment are essential to produce safe food through the protection of animal health and welfare. Now, that's the way Dave says it. The way I would say it is, you know, you get safe food from healthy animals, and it's usually more efficient to try to prevent or control disease than it is to treat it. We will work closely with regulatory agencies to ensure that these uses are preserved. In spite of this, there are advocacy groups and legislators calling for additional actions. Instead of letting the processes underway have a chance to work, they want to declare them a failure and impose restrictions through legislation that are unlikely to have any positive impact on human health or provide an improved understanding of resistance. And you probably know who the person is that usually leads that charge, and that would be Mrs. Slaughter, who's a congresswoman from New York. And she has again introduced a bill that would make it illegal to use medically important antibiotics for growth promotion, but she also wants what she calls routine disease prevention to be banned. Bad idea. She's also introduced a bill to collect more data on antibiotic use. She basically wants it to be federal law that all antibiotic use is reported to the federal government, and it would require reporting this data to the FDA, which would not help us understand resistance and not provide an opportunity to benchmark. Collecting data on gross pounds of antibiotics used isn't meaningful. If each farm, veterinarian, or feed mill were required to report it, it would overwhelm FDA's ability to receive and analyze the data and would be time-consuming and costly for farmers, veterinarians, and feed mills. On the Senate side, Senator Feinstein from California has sponsored similar bills. NPPC is working with other commodity groups and stakeholders to ensure that these bills do not move forward. The changes that will result from the implementation of FDA policy and the CARB initiative are significant, and legislating further action changes, especially those that have no basis in science, is not necessary. NPPC is supportive of the outreach efforts to make sure that producers and veterinarians understand the changes that will need to occur with the implementation of Guidance 213 and the BFD rule. We're supporting the research and producer education activities that you will hear more about in the pork checkoff briefing later this morning. We need to move forward as an industry to make sure that we're preparing for the implementation of Guidance 213 and the BFD rule. And I will point out that our biggest challenge is, you know, NPPC represents 68,000 pork producers in the United States. And it is a big challenge for us to make sure that they are aware of what the changes in the law will require. In my opinion, it will be something that will be most important and most challenging for small producers. You know, large companies and integrated systems like my family's business have staff veterinarians that, you know, they're the ones that handle those things and make sure that we stay in compliance. But some small independent that now has to comply with this stuff has got a different challenge than what a Prestage Farms does.